My dear friend Latika and I once met over a cup of coffee. And as the conversation was flowing, she suddenly was tear-eyed. "Oh, what happened, Latika?" I asked anxiously. Latika replies, "Remember, I used to be so fit in the college days. And look at me now. I have gained oodles of weight. You know me, right? I do not overindulge in food. But these days, along with weight gain, I don't feel like getting out of my bed. I'm so forgetful most of the times and I just don't have the energy for workout. And look at me, I'm gaining weight by the minute." Wait, Latika. It's not your fault. When was the last time you got your routine blood work done? Latika, wiping her tears, mentions, "Maybe 2 years back." Now the things Latika just mentioned look like a classic case of hypothyroidism to me. But I have to rule out the other things like low iron levels or a B12 or a D3 deficiency. So I asked her to get the test done and give me a call after she gets the reports. As suspected, her TSH level were way beyond the threshold levels and she was having severe hypothyroidism. No wonder Latika is in an emotional roller coaster ride, which is again a symptom of hypothyroidism. Many clients who visit the clinic for weight loss do not realize that the underlying cause might be hormonal imbalance like hypothyroidism, PCOS, or diabetes. It's best to get your routine blood work done once in 6 months, and you can ask your physician which are the tests needed. While treating clients affected with thyroid diseases, I realized that there are so many misconceptions around it. That's why in today's episode, I thought I will take up 5 most common misconceptions around these and try to help you with the truths with evidence. Hi, I'm Avantii Deshpaande, clinical nutritionist, author, speaker, entrepreneur, and a fit mom. Welcome to my podcast, Eat Smart with Avantii, reconnecting you back to the Indian roots. So let's just understand some basics. The thyroid gland is a small organ located in the front of the neck wrapped around the windpipe, that is the trachea. It's shaped like a butterfly. The thyroid controls your metabolism with few specific hormones. T4, that is thyroxine, and T3, that is triiodothyronine. These two hormones are created by the thyroid as they tell the body cell how much energy to use. When your thyroid works properly, it will maintain the right number of hormones to help your metabolism working in the right state. As the hormones are used, the thyroid creates replacements. This is all supervised by something called as the pituitary gland, located in the center of the skull below the brain. It releases the thyroid stimulating hormone, also known as TSH, which maintains the balance of the circulating thyroid hormones. The two main types of thyroid diseases are hypothyroidism and hyperthyroidism. Both conditions can be caused by other diseases that impact the way the thyroid gland works. Thyroiditis, caused due to the inflammation of the thyroid gland. Hashimoto's disease, which is an autoimmune disease. Pregnancy-induced hypothyroidism. Hypothyroidism can also be caused due to iodine deficiency. A non-functional thyroid gland, which is a birth defect and can be screened immediately after birth. Other hormone imbalances which could lead to diabetes or PCOS could also cause hypothyroidism. So it's best to keep the screening for this. Okay, now that we know the basics well, let's move on to 5 common misconceptions and its truth. Misconception 1. Monica, having hypothyroidism, asks me, "So, I've stopped eating cabbage, cauliflower, spinach ever since I have been diagnosed. Is it a right thing to do?" Now here's the truth. Not just Monica, most of the clients with hypothyroidism have this same thought process. Vegetables like cauliflower, cabbage, broccoli, bok choy, Brussels sprouts, radish, turnips belong to a group known as cruciferous vegetables. Cruciferous vegetables are low calorie. They are rich in folate, vitamin C, vitamin E, and vitamin K. Along with that, they are also rich in fiber. Fiber is an important nutrient to incorporate for weight loss if it is a goal, as it keeps you fuller for a longer period of time. Cruciferous vegetables are feared in hypothyroidism because they contain goitrogens. Now, what are goitrogens? These are dietary substances that interfere with the thyroid metabolism and can aggravate the effect of iodine deficiency. Most goitrogens do not have a major clinical effect unless they are consumed at high levels and iodine deficiency is present. Cruciferous vegetables are also good sources of phytonutrients, which are plant-based compounds that may help lower inflammation and reduce the risk of developing cancer. According to an article in Indian Express, one need not stop eating cruciferous vegetables. By cooking or steaming them, the goitrogenic properties are reduced significantly, it noted. Also, a study in humans found that the consumption of about 150 gram per day of cooked Brussels sprouts for 4 weeks had no adverse effect on thyroid function, as per an Oregon State University analysis. Similarly, consumption of high amounts of cruciferous vegetables has been associated with increased thyroid cancer risk only in iodine deficient areas, it noted. The geographic location also determines the content of goitrogens in the cruciferous vegetables. Hilly areas are known to have more goitrogens. So, if I get a client from Uttarakhand or Sikkim, I would ask the clients with hypothyroidism to consume these vegetables more judiciously. Now, here is the irony. Hypothyroidism, which is caused due to an autoimmune disease like Hashimoto's, can be treated best when you increase the consumption of cruciferous vegetables. So, it's best to take a calculated risk and keep checking the scores in between. Misconception number 2. Mrs. Sethi mentions that stopping wheat completely got the hypothyroid under control. She then continues, should I avoid having wheat lifelong? Wheat contains a protein known as gluten, which could be a cause of low-grade inflammation, a cause of hypothyroidism, but not all persons having thyroid disease have low-grade inflammation. Unhealthy lifestyle is also a cause of hypothyroidism. One theory is that when you avoid wheat products, you automatically avoid bread, pizza, pasta, burgers, as they all are made out of wheat. It also means that you avoid all the bakery items like cakes, pastries, cream rolls, and biscuits. This way, you're automatically moving to a healthy lifestyle, which could be a reason you see favorable results. Alternatives to wheat is using millets like jawar, bajra, ragi in the form of rotis or directly millets. But there is often an argument among scientists that millets also can act as goitrogens. But here the results are inconclusive. This is how my approach is when I advise my clients. We identify if there is a possible inflammation, which could be detected with the help of a diet recall and symptoms like redness, hives, or allergies after consuming gluten. Then, I could give a fair chance to make changes in the lifestyle, meaning changes in the diet like adding more fruits and vegetables, low carbs, high protein and moderate fat. And along with this, I would give them low to moderate intensity workouts. If we see positive results, we do not exclude wheat. Certain blood work like blood CRP or even glucose intolerance tests are available, but it's expensive and it's best to be done under the supervision of a doctor. Misconception number 3. People with thyroid condition will be on medication for life. Now here is the truth. This is a misconception for sure, and I have seen real-time results during my consultations. It depends on the cause of your condition. Shilpa was associated with me for diet consultation during pregnancy. She did not have hypothyroidism before conception, but developed it during the first trimester. This is common with a lot of women, and it's known as pregnancy-induced hypothyroidism. The reason for this being pregnancy puts extra load on the metabolism due to the changes that happen in the body because of pregnancy. Now, after delivery, Shilpa's levels were back to normal as she was managing her diet very well and started with light workouts after 21 days of childbirth. There are a few clients who visit my clinic with borderline hypothyroidism and want to give lifestyle change a fair chance. Once we get some routine blood work done and rule out the other causes of inflammation like Hashimoto's, then we can give them a fair chance to manage hypothyroidism with lifestyle changes first. I too have witnessed a reduction in the dosage of the medications taken by my clients, maybe from 100 mg per day to about 50 mg or even 25 mg per day after there is a weight reduction and they start being more active. According to an article in Harvard publication, all treatments for hypothyroidism, even borderline cases, must be individualized and monitored carefully by the physician. That requires measuring TSH 4 to 8 weeks after starting the treatment or changing a dose, another TSH test after 6 months and then after 12 months. Misconception number 4. Pratik, diagnosed with hypothyroidism, discusses his concern with me. So my weight loss will be slow, right? Now that I have hypothyroidism? Here's the truth. Not just Pratik, but almost all clients who seek advice for hypothyroidism management are stressed about the fact that hypothyroidism will make losing weight difficult. But for all of you who feel that, I have some great news. We have seen successful weight loss in hypothyroidism clients as the ones who don't have it. When you are on medication, your thyroid functioning is at par with the normal adults. All you need is a perfect anti-inflammatory diet and routine in terms of the workouts that need to be done. And then you can see the miracle happen. Misconception number 5. Do I need to take iodine supplements for managing hypothyroidism? It's true that not having enough iodine, that is iodine deficiency, can be a cause of hypothyroidism. But iodine deficiency has been rare since iodine has been added to salt in the form of iodized salt and other foods. If the underactive thyroid isn't caused by iodine deficiency, then iodine supplements give no benefit and shouldn't be taken. In fact, some people with underactive thyroid, too much iodine can cause or worsen their condition. But here, I would like to emphasize the necessity of using iodized salt. Iodized salt has proven to be the most effective means of providing one with consistent levels of iodine capable of eliminating diseases. The recommended amount is 150 micrograms per day for adults, 200 micrograms per day for pregnant and lactating mothers, and lower amounts for children. These recommendations stem from consensus statements by several groups, including the International Council of Control of Iodine Deficiency Disorders, the World Health Organization, UNICEF, and the Food and the Nutrition Board of the US National Academy of Sciences. Of course, you cannot let go the fact that higher salt in the food is harmful. So make it a point to use iodized salt for cooking purposes, and in place of table salt, use pink salt or rock salt. Don't make the mistake of replacing iodized salt totally with any other naturally occurring salts if they are not iodized. तो फिर जागो ग्राहक जागो. Be smart and read the labels well. sincere effort on my part to throw some light on hypothyroidism and its misconceptions. Hope I could clear some doubts. Signing off on today's episode. For personalized advice on hypothyroidism, we have got a 12-week program and you could know more details about it on our website avantideshpaande.com. Let's connect next week with yet another interesting subject in nutrition. Do not forget to follow this podcast, Eat Smart with Avantii, for more interesting topics in health and nutrition. Have you subscribed to my YouTube channel yet? Nutritionist Avantii Deshpaande? नहीं किया है तो अभी कर लेना. और क्विक हेल्थ टिप्स एंड रेसिपीज के लिए इंस्टाग्राम हैंडल है nutritionist.While. Stay tuned until next week. New podcast coming up every week.